Now, you might be tricked a little bit on sickle cell because they're going to give you the sickle cell crisis patient, and they're going to have all the classic features of a crisis. You're going to have the pain, the pallor, but then they're going to also be tachycardic, tachypnic, and they're going to throw in a fluent. It's going to be a pulse ox, less than 90. What is your first nursing action with this patient?
Oxygen. With the sickle cell patient? Okay.
What's your first nursing action, baby?
For the sickle cell.
Of that patient.
That patient.
Yeah, of that one.
For that one, maybe the
Yes. It's oxygen?
that.
When you done, Mom?
Yes, IV fluids. I'm sorry.
Oxygen. Okay.
Okay.
Oxygen.
You get one thing. What do you want, baby? You changing gas? I thought it was friends. You got mine, I got two. What the fuck? I gotta get out of here. Bring it back. Okay. So, of course, on this lovely little board here is our next lecture. And what they do to you on this test is see if you can critically think. Yes, the first nursing action with most sickle cell. Most, I said. Hydrate is always first, unless. Unless you have a respiratory distress, because that'll kill you first. And you have a clear sign of respiratory distress. Critical thinking. Don't be an absolutist. So here's what I'm saying to you. If it didn't have pulse ox less than 90, you would hydrate the shit out of this patient. Your most important teaching, which is also something you gotta know for next week, is to teach push fluids. It has always been your priority, unless death is impending because you got freaking respiratory distress. The minute I threw a pulse ox less than 90 in there, I complicated your answer. Does that help a little bit? Okay, because it's such a controversy with you guys. You guys have told me this for years because they don't change much. And you told me, well, I thought it was this, but then they put the pulse ox less than 90, and then I thought it was, okay. Pulse ox less than 90 is still a medical emergency for oxygen. If I don't put the pulse ox less than 90, which by the way, 99% of all my sickle cell crisis patients did not have a pulse ox less than 90. So 99% of all my patients got fluids first. Don't rely on it, but yes. In a rough kind of way, that's a good rule of thumb, but there's so many times where it doesn't prove true, but I'm with you on that. I'm definitely with you with that ABC shit. Okay? Sometimes it doesn't help you, but this time it did. Yeah. This person's got a pulse ox less than 90. Don't ever forget that it's respiratory distress. It's in the song. There you go. Okay. All right. So that was a big deal for your patient. Now let's just remember the rest of the H-top, and then we're done with this board, except for HIV, which is really easy. Hydrate, hydrate, hydrate. Biggest priority with normal sickle cell. hydroxyurea is the medication, maintenance medication. It stimulates production of fetal hemoglobin. What do we know about fetal hemoglobin? What's so special about it? It's perfect. There's nothing wrong with it whatsoever. Except you cannot give this for obvious reasons to a pregnant lady. For obvious reasons. She don't need her fetus's hemoglobin stimulated. But if you have sickle cell, hydroxyurea is going to stimulate fetal hemoglobin. It's perfect. It lasts as long as yours. How long does ours last? How many days? 120 days. How long does a typical sickle cell patient's blood last?
12 days.
12 days, you remembered. Sickle cell patients' blood cells only live 12 days. Yours and mine, 120 days. When you give them hydroxyurea, you give them fetal hemoglobin. Now you have a patient, an adult patient, whose blood cells are going to live that long. What's true about sickle cell? Both parents have to have the trait. Okay, the other things. I'm going to beat all of you who said treat the pain first. I'm just going to beat you. Because pain is never a priority unless you have what you'll need to know in 2501, pancreatitis. That's the only time pain is first. With this guy, it is not first, but when you do treat it, will the Tylenol work?
No.
Hell no. Narcotics, right? Okay. Should we give this patient a little iron?
No.
Hell no. Because what is iron going to do? It's going to stimulate production of red blood cells. What's wrong with theirs? They're sickled. What are triggers real quick? Cold,
Elevation.
elevation.
High altitude.
This should have been out your mouth first.
Dehydration.
Because if the treatment is hydration, the trigger is dehydration. One of the things I tell you to do is to take our code, whenever you're thinking of triggers, H, hot, the H also means heat, and do the opposite, and that's the triggers. Okay, so if hydrate is a treatment, dehydration is a trigger. If heat is going to help the patient, then cold is a trigger. If oxygen helps the patient, then high altitude is a trigger. Put in parentheses, airplane rides. Okay? Now, it's interesting. Even though heat feels better to the patient and it vasodilates, too much heat can be called exertion or fever or a really hot day. And all three, exertion, fever, really hot day, will increase your need for oxygen. How do you get oxygen? You produce more red blood cells. That's not good because they're all sickled. I'll try that again because it's important. Exertion, really hot outside, fever, and by the same token, infection, right? Because that's what you get fever. That's going to make you need more oxygen. All three of those things make you need more oxygen. So your body's going to kick in and produce more red blood cells, and when that happens, they're sickled. So you get into trouble with sickling. So it's a trigger. Exertion, heat outside, fever, infection, dehydration, cold weather, high altitudes. They're all triggers. Anything that vasoconstricts, smoking. You're suicidal if you smoke with this. And we know people who do, but they're suicidal, basically. Okay, because what are you doing? Okay? Trauma is one of the worst things because you can't really necessarily prevent all trauma. Things happen. And my student's 14-year-old daughter was waiting outside for the school bus. She slipped on the ice before she stepped up to the school bus, called her mom, went to Rainbows, fucking died. Trauma. Don't forget trauma. So no contact sports. Yes? No contact sports. Okay, you're not going out for football with this shit. Okay, where your HIV packet at? You ain't got much on there. Plus we just did it. Raise your hand if you don't know this. I will beat you in high school. You should have an HIV packet in there. So, oh, it's probably cancer. See if you can find it. It's not. If you don't have it, your old one is fine, and those of you who don't have that, there's nothing on there that you can't figure out. What kind of precautions do they tell you?
Like me and you and me.
Standard. Give me some opportunistic conditions for the HIV patient. Huh? Some opportunistic infections for the that's better. Number one is TB. Give me some more. Histoplasmosis, candidiasis. Yep, pneumonia. Yep, Kaposi sarcoma. What is Kaposi sarcoma anyway? Is that an infection? It's a cancer. These are opportunistic infections or conditions. Cytomegalovirus. Who has that walking around? Kids. What's the other one with King Cat litter? Toxoplasmosis. So histoplasmosis and toxoplasmosis sound a little bit alike. Don't forget these. Invasive cervical cancer, lymphoma, which is your Hodgkin's and non-Hodgkin's. Lymphoma is Hodgkin's and non-Hodgkin's. You got me the candidiasis. These are good. What does an opportunistic condition really mean, bottom line? It's AIDS. You moved into AIDS, correct? So if a patient comes in with this opportunistic infection and they have been totally fine for 10, 15 years, and they walk in, like my stepbrother did, with PCP, they've crossed the border, they're now full-blown AIDS. How about a CD4 less than 200? What does that mean? AIDS. And what's a normal CD4?
800 to
1,000, 1,500, 800. Anything over 800, y'all right? Viral load, what's that?
Presence of virus.
Level of infection in the body. How do we confirm HIV? Western blot is confirmation of HIV. Just remember this, because what I do, we draw one tube of blood and it goes through 3 tests. Western blot is the ultimate confirmation. Western blot is the ultimate confirmation. So standard precautions, aseptic technique, yada, yada, yada. Keep it moving, shit. That's the easiest thing on the test.